Delhi is on high alert. The H3N2 influenza virus is spreading fast, with hospitals reporting a sharp rise in fever, cough, and breath-related cases. Experts warn that this flu season is more aggressive, striking hard and lasting longer than usual. To help us understand the risks and the right precautions, we are joined by Dr. Shivangini Bora, pediatrician at Baby MD, Children's Clinic, Bangalore. In this exclusive report, she breaks down what's driving the surge, who is most vulnerable, and how can you protect your family?
Hi, I'm Dr. Shivangi Bora, a pediatrician, allergist and asthma consultant, and pediatric sleep consultant practicing at Baby MD, the Children's Clinic in HSI, Bangalore. So recently we have had a lot of cases, particularly flu cases, and we had a bunch of questions regarding the disease. Now the first question was, what is the H3N2 virus and how does it spread? So the H3N2 is the influenza virus primarily belonging to the category of influenza A. And how does it spread? It spreads like any other respiratory illness causing viruses, that is through droplet. So anyone who comes in contact with droplets or aerosols are prone to acquire the infection. The second question that was asked was, what are the common symptoms associated with H3N2? So the commonest symptoms that H3N2 can present with is flu-like symptoms like a runny nose, cold, cough, and fever. So again, now there was this question, in what ways does H3N2 differ from other viral infections such as the flu or COVID-19? So to answer this question, the H3N2 itself is the flu, right? I just mentioned it falls under the category of influenza A. And how does it differ from COVID-19? So when COVID came, it primarily caused respiratory illnesses, and with the different variants, it was very serious. The catch with H3N2 is that it is a fast mutating virus. It mutates very fast in the environment and tends to cause serious illness on and off. It will come, sometimes it might cause mild infections, sometimes it might cause very serious infections. The most common symptoms of H3N2 are, as I mentioned, flu, running nose, cough, cold. But again, in certain cases, it tends to cause very high fever that doesn't go down very soon and continues for a longer period of time, sometimes even leading to a benign condition known as febrile seizures in children. Again, it has also been seen that the influenza can cause diarrheal illnesses in children. However, these were not seen with COVID-19. More commonly, COVID-19 caused respiratory illnesses, and with the varying mutants, they became weaker over time, and now it passes off as a mild flu. Supposingly I get infected with H3N2, what are the next steps that I should take? So once you're infected, first of all, you would not know the point exactly at where a person is infected, but certain symptoms, as I mentioned, beginning from the flu to very high grade fever, prolonged periods of illness, sometimes even diarrheal illnesses can point towards being infected with the flu. In these conditions, what you should do is, number one, keep yourself very well hydrated. Hydration is the cornerstone for treating any illness. Secondly, temperature control. Please stick to paracetamol as far as you can. In other cases, you might upgrade to certain other medications which can reduce temperature. Third is watching out for signs of serious illness like chest tightness, breathing difficulty, fever for a very prolonged period of time, intractable diarrhea, you have very bad cramps and your diarrhea is progressing. Sometimes a benign condition like febrile seizure is seen in young children when the fever spikes are very high and do not come down very soon. Okay, so these are the signs that you would want to watch out for. The activity of the child, the hydration status of the child are very important. If any of it seems doubtful or you are in doubt, please reach out to your pediatrician and consult immediately. So the last question that we had was, what are the ways and some of the effective tips to stay safe and prevent infections? So the first preventive step is hand hygiene. Please wash your hands frequently, especially after coming in contact with surfaces, because we don't know what each surface is harboring. Second is wearing masks in public places that prevents us from getting infected. Third is building our internal immune system, and how we do that? By zinc, vitamin C, and a good store of vitamin D that builds our immune system immensely and helps us from not falling seriously sick even if we are infected with such common flu. Okay, and the last and the most important is taking the flu vaccine. So it is very important for young children, the elderly, those with pre-existing conditions like asthma or heart disease to go forward and take the annual flu shots, and if not taken, to start this process of vaccination so that you can protect yourself and your dear ones from becoming majorly sick once you contract the flu. These are your preventive measures.